insights into normal and abnormal growth. I have no disclosures. Of course, we have a very complex area that I find very interesting. We have the epiphyseal cartilage, then it becomes a secondary ossification center, and then the physis, the metaphysis, then we get this zone of provisional calcification that lies between there, as well as a small region called the metaphyseal spongiosa. And then, of course, the secondary physis and the articular cartilage. So what I've been focusing more on has been the growth plate, and especially what happens with the chondrocytes when they go from being in the resting zone, where they're being the stem cells quite small, when they move over to the proliferative zone, when they become sort of like small bricks on top of each other, and then when they move into the hypertrophic zone, they balloons like fried egg and then breaks, and we have calcium that leaks out, which then causes the mineralization, and then it turns over into bone in the primary spongiosa. So I'm not a histologist, but my thing is to, how can I have something like this? Here we have those very nice columns, and then we have MRI that is something like this. And how can we then create the growth plate that, of course, is like this plate between it, and how we can get insights in how it grows. So in an MRI image, we can actually see it fairly well because we have this bright line that is usually the primary spongiosa, this black line that is a zone of provisional calcification, and then a white line